starting the day by inviting Ms. Sanjana Mishra. She is a well-known psychologist, a narrative practitioner, and enjoys working with youth. I feel proud that she made mental health to be viewed from the lens of intersectionality in importance of understanding and working with gender and sexuality.
Hi everyone. 1 second, sorry. Having tech difficulties today. Okay. Yeah, thank you. Great, all right. Yes, so we're going to be talking about pronouns today, yeah. And I thought we could do two elements to it. One could be a little more interactive, where we have some small activities that we do, yeah. And one could be more information based. So we're going to be doing a combination of both of them as we move forward. So I'm Sanjana, I'm a psychologist. I work at an organization up to the age of 25 on a variety of concerns, but gender and sexuality is one of my personal interests and something that I'm really interested in sort of working with, both with therapists and with people outside of the therapeutic space. So I think one of the questions that sort of comes to mind when we're talking about pronouns is sort of just how can we talk about pronouns or talking about gender, right? So I'd like to kind of begin actually with a little bit of a reflective activity, and I'd like you guys to carry this with you sort of as we go through the session today, yeah? So do you have paper, do you have phones, anything that you guys can note stuff down on? If you do, please take it out. Yeah, we'll just take 5 minutes for this, just to think about the idea of whether you have given thought to your gender identity and what are some of the thoughts that have come up on these lines for you. Yeah, so just like you can note down little points, you don't have to write down full sentences or anything, and we'll just carry this with us as we move forward. Yeah. I think we're all mostly done. Yeah. Does anyone, if anyone has any thoughts that they want to share right now, we can do that as well. Anything that came up for you that you'd like to share with everybody before we move forward, or do you want to kind of move to the next thing? We can also come back to this at the end of the session and see if, you know, what we kind of covered today made you think back to these questions. Yeah? Okay. So, what I'd like to talk about a little bit, I'm sure you might have come across this illustration before. We're going to talk purely about identity and expression today because we're talking about gender. Yeah. So the ideas that came up in this previous section about, you know, what have you thought about your own gender identity? What are some of the things that, you know, you realized about it growing up? What are some of the things that, assumptions that people made that were not okay with you in some capacity? Those are all things that can be a part of your gender identity, how you perceive your gender, right? How you understand it, like how, say, multiple people in this room may be women, for example, but how we all understand the concept of being a woman, how we feel about being women may be very different, for example, yeah? So identity as an element of gender is something that's a lot more mental versus how you express it, right? Through clothing, through your name, through the way that you act, all of those things come under the realm of expression, right? So somebody who, say for example, may again identify as a woman, let's say, but dress in a very quote-unquote tomboyish way, right, may still continue to identify as a woman, but may just have a different expression of that gender, right? So essentially how you feel about your gender and how you express it visually or verbally or in any way can be very different, right? And I'm just talking about, say, like very binary concepts of gender right now, like men and women, but there also, again, if somebody is, say, non-binary, or if someone is trans, then their gender identity and the gender expression may be vastly different, or they may change from day to day, right? Like today, suppose I'm here dressed like this, tomorrow I may be here dressed in a completely different way, but my gender identity may remain the same in spite of that. Is this making sense? Yeah? So what we're looking at today, why we're looking at pronouns today, is because the way that someone looks, or the way that someone acts, or the way that someone presents themselves does not actually say anything necessarily about the gender that they identify with. Yeah? So that is essentially why we're talking about pronouns right now, because you can't assume what gender a person has by the way that they look. So essentially what I said, people tend to make assumptions about the gender of a person. We all do it, right? I'm probably making assumptions about your gender right now, you're making assumptions about my gender. It's fairly ingrained in all of us to do that, yeah? But the fact is that these assumptions may not actually always be correct. And even if they are correct, it sort of sends this message ki just because I've assumed this person's gender and that gender has actually been correct, that I can assume everyone's gender and that will always be correct, right? Which is, as we know, we're here because we want to be sort of affirming healthcare professionals some way or the other. We know that that's not true, yeah? So the message that then kind of gets sent across is that people have to look a certain way to present themselves as the gender that they are, right? So again, you have to dress a certain way as a man, you have to dress a certain way as a woman, or even there are certain standards as, say, a non-binary person. You have to dress only in androgynous clothing, or you have to, let's say, you can never wear quote-unquote feminine clothing, right? Or you can't wear a dress, or you can't wear a sari. And those are the kinds of assumptions that come up even across different like gender expansive identities, not just in binary genders, yeah? So I'm also referring to them as personal pronouns here. And you may have heard phrases like preferred pronouns before, yeah? Personal pronouns doesn't mean that, you know, they're secret pronouns, or they're very personal, private to the person, because actually pronouns are never used by you yourself. They're more by people around you to refer to you, yeah? It's personal because they belong to you, right? They're your pronouns, and they're referring to a person, essentially. So when people say preferred pronouns, that can sometimes be invalidating to people, because it may send this general message ki, okay, like these are your actual pronouns, but tell me what your preferred pronouns are, you know? So it's almost like this is the truth, but you can kind of choose your reality, which is not true, again, because the pronouns that you align with are yours. They're a fact, right? So a lot of people prefer to use personal pronouns as a descriptor rather than preferred pronouns. The sort of difference in that is that some people may use multiple pronouns, right? They may use both she and he pronouns, they may use both he and they pronouns, for example, in which case they may have preferred pronouns between those two pronouns, yeah? So in that situation, asking about preferred pronouns may be helpful. So some examples of pronouns that people may use are, we're fairly familiar with she and he and their variations, yeah? We may also be familiar with using they and them pronouns for people. Yeah, there are also what are called as neo-pronouns. So people may sort of come up with variations of pronouns that fit with their gender better than, say, just she, he, or they, right? So one of the examples is ze and her is one of the pronouns that people use. There are different kinds. So again, I've picked just one example here because I think there are infinite possibilities depending on what you identify with more. But yeah, so essentially you may choose pronouns that align with your gender identity. It doesn't have to just be based on your identity and expression like we just sort of spoke about. Yeah, so if your identity is something, you can choose your pronouns to align with that identity. Yeah, but your expression of gender doesn't have to match that. I hope I'm making sense so far, yeah? Before we kind of get to the point where we ask about why should we care about this, why should we talk about this, why should, say, healthcare professionals kind of bring this up, yeah? I thought, again, we could try out something small within ourselves, yeah? So one of the things that you can do to make it a little perhaps safer for someone else to share their pronouns with you is to share your pronouns with them, right? So I may come up here and I may say that, you know, I'm Sanjana and I use she, her pronouns, yeah? So I'd like you to try that out if you can with each other. You don't have to move around. I know we're in a closed space. Maybe just turn to the person on your side, try introducing yourself with your pronouns to them. Yeah? Is there confusion? What about you guys? Did that feel weird? Honestly. Yeah, felt a bit weird. So I think that's also why we did it right now, because we're not used to doing it. Yeah. I also want to point out that this may not be something you do in every situation. You may not go to every space you're in and be like, yes, I am so and so and these are my pronouns. You may not do that everywhere, right? But to become more comfortable and to make people more comfortable in kind of sharing this with you, you may have to start doing it in certain spaces, right? So ये weird feel करेगा. This is going to feel weird for a while, yeah. I still feel strange about it sometimes. I feel like I feel I'm very aware of myself when I'm introducing myself with my pronouns, right? Because you don't know how people outside may kind of react to that, what assumptions they might make about you if you're sharing your pronouns with them, right? But to create a safer space for trans and gender non-conforming people, it is important for us also to kind of do our bit in that sense, right? And one of the main things that you can do is share your own pronouns so that people may feel more comfortable sharing them with you, yeah? So we push through the weirdness for a bit, yeah, until it becomes a little less weird, thoda sa, just a little. And once it does, then maybe spaces become safer across just this tiny group of people, possibly. Yeah. Okay. More about why should we care? Yeah. So I'd like to just kind of direct you to this thing that a young trans person shared about what misgendering means to them, what being called by the wrong pronouns, what being referred to as the gender they don't identify with means to them. So they say that when you call me the pronouns and name that I no longer identify with, it says you don't exist. It says I don't see you and I value my view of you much more than I value your comfort and safety. Misgendering me hurts my feelings a great deal. I know I might look a different way now than I did, but I am still me and I have always been me. And you using the name and pronouns that I use now is a way to validate that and to say that you see me. Yeah? So by doing something as small as, say, asking someone about their pronouns or making sure that we use the ones that they have shared with us, we may be just acknowledging a person. It may not be a huge act, it may not be, it may not change the world in that sense, but it might be a huge acknowledgement, a huge like, I see you to that person. Yeah, and coming back to the first bit, when we do these things that are weird for us, things that are strange for us, things that take us time to get used to, we start creating an environment that's not just like accepting or friendly, that's not just built around the idea, okay, yes, fine, I know about all this and I have no problem with it, so that's enough, right? But the thing is that that's not actually enough. It has to be a more affirmative environment. It has to be an environment where you're putting in that little extra step, that one tiny thing, that one strange, hello, I'm so and so, these are my pronouns, right? To create a space that's possibly just that 1% more affirming to somebody. Yeah, rather than just like, okay, if I walk into this room right now and I see all of you, since I'm here, I'm in this conference, I may assume that yes, you are all, affirmative professionals and you are people who will understand if I talk about my gender. But if I come across you in a space outside of this, if I come across you in a clinic, if I come across you in any environment, I may not know that it's safe to talk to you about my pronouns or my gender. Yeah. So that is what kind of creating an affirmative environment can mean to somebody. It can be the difference between, should I test the boundaries of this person or should I actually assume that they're safe? Can I assume that they're safe? Yeah. So just something as small as this can help create an affirmative environment. There's a lot more I'm sure that we can do, but we're talking about pronouns today. Yeah. So we need to kind of just stay with this idea, this one small thing that can shift. Yeah. So if I were to sort of ask you, again, this is something that you can maybe discuss amongst yourselves or you can speak up about it, whatever you feel comfortable with. What are some things that you'd like to change or some changes that you'd like to see in your, say, in your university, right? Or if you think about moving forward into the future, the space that you want to work in, how might that be different if you tried to kind of incorporate the idea of being affirming to someone's pronouns into it? Are there any thoughts that come to your mind, anything that can be different right now in your university also? Okay. If you don't want to kind of maybe share it with everybody at the moment, can we maybe just talk amongst each other in groups of 4 for a few minutes? Just whatever it is that you're taking away from what we're talking about right now, what are the changes that you want to see based on that? Yeah, like the 4 of you here, 4 of you there, just like wherever you're sitting, just 4 mein. If you can just have these conversations. Yeah.
Providing a basic idea to each and every student of the university and providing the separate washrooms and toilets for them. And ma'am, even not in our area, not in our university as well, we have to provide a basic idea to everyone in the community. As we all know that the pupils are following the same trend as their ancestors used to do. So I think each and everyone should have a basic idea regarding it. क्योंकि अभी भी हमारी सोसाइटीज़ में अगर ऐसा कोई बेबी बर्थ लेता है तो लोग बहुत ही काइंड ऑफ उसको एविस्प्रेट एंड ऑन मानते हैं ना, तो उसका ट्रीटमेंट भी करवाते हैं. सो ये सब ठीक है.
बिल्कुल. थैंक यू फॉर शेयरिंग दैट. ऑफ कोर्स आई मीन आई वाज थिंकिंग ऑफ एरियाज ऑफ वर्क बिकॉज हम affirmative care की बात कर रहे हैं, but you're so right, it has to not just be in your workplace but also in your communities in different ways, right?
Majorly in community.
Majorly.
क्योंकि as we all know that we are enough educated so that we can address them with a proper pronoun. But in community there is lack of knowledge, education, even more जो लोग ज़्यादा पढ़े लिखे होते हैं, I think they too behave very weird to them. So I think there is need of awareness among the community as well.
Absolutely. Yeah. So I think knowledge in general is important here, right? कि it's not just about कि हमें पता है कि pronouns क्या हैं, we know what to do about them, but also like again like what are we talking about today, right? Why should we care about them? Why should we bother to say introduce ourselves as pronouns? A part of it is to build more knowledge in community spaces, right? So as you know, we're finding it, like you said, perhaps we're all here in this space because we've learned a little bit already about this, and some of us are still finding it weird, or most of us are still finding it strange to introduce ourselves with pronouns, right? So to actually get to the point where we can say, okay, my mother or my father or my grandmother may understand this one day, we perhaps need to create a little bit more space amongst our communities, like you're saying. Yeah. Any other thoughts that have come up for anyone?
Hello.
Hi.
Good morning, ma'am. Actually, I want to just give a suggestion. We can start from our home. We can start this acceptance behavior from our home, to our elders, to our siblings, to our next generation. We can start this from home. We can show the accepted behavior, like yeah, it is normal to be friend with them, to talk to them, then they can follow from home. And they will not get a different feelings like, no, they are different species kind of thing.
Right.
So I will just suggest Like we are 30 to 40 people. If we can start from today, it will definitely make a change in coming 5 years or 10 years. We can tell to 10 more people, they can tell to 10 more people, like a chain. So this is just an understanding. If you are taking it from heart, you can start from your home. This is a very simple change, but definitely it will affect.
Absolutely.
That's all.
Thank you so much. I think the overwhelming understanding that we're kind of getting today is that it's not so much just about work, but also about what are we doing at home, what are we doing in our communities, what are we doing in our actual spaces we spend more time in than our workplaces, right? I think that's really important. I'm sure we've all heard from parents and grandparents and other people at home about just a lack of acceptance, I guess, a lack of understanding also maybe. Yeah, so maybe this can be one of the things that helps bridge that lack of acceptance, lack of understanding. There's also, I think one of the other reasons we're talking about this today is it feels like a small place to start. Rather than talking about, okay, gender is not a binary. These things are not, it's not just about this. Just something as small as saying, okay, sometimes people use pronouns that are not just he and she. That alone, I think, can start a lot of conversations. And I think Lavina will also talk about this later. But when we work with parents of kids who are trans and gender non-conforming, very often they, they don't know where to start. They're just like, suddenly my child has come and told me this and I don't know what to do with this information. I don't want to hurt them, obviously. But they also don't know how to begin. So I think this is always a very good place to just start. Be like, okay, fine, we're getting used to understanding. We'll understand more about gender in general. But if we can just start by pronouns, that alone also feels like a big step for both the parent and the child. Right? So I think, again, like homes and communities are very important spaces where this is seen. Yeah. Thank you so much for mentioning that. Yeah. Anybody else with any thoughts about this? Okay. I also thought I'd show you this very interesting little worksheet from this resource called Teaching Outside the Binary, where in a classroom, a teacher can share this with a student and ask them, okay, like, what is the name that you prefer that I refer to you as? What's the name that you'd prefer I call you in front of your classmates, in front of your parents, right? So very often, maybe you can create an inclusive space for somebody at university, at school, without actually it becoming like a whole maybe conversation you end up having with their parents, right? Or what kind of pronouns are you okay with me using with your friends? What kind of pronouns are you okay with me using with your parents? That kind of thing. So those little changes also are these are little things that people have done in their workplaces to bring in questions of like pronouns, just pronouns at the moment, but gender at large as well. Something I think that we also need to maybe come back to is what happens if, let's say, we make a mistake in the sense that someone has shared their pronouns with us, but we accidentally use the ones that we used to use for them before, right? Usually a very good and safe thing to do is just correct yourself and move on. Sort of not apologize very strongly about it, not make a big deal about it, not be like, okay, we are, oh my God, I made a huge mistake or whatever. It's understandable. There are things that we're used to, there are things that we're not familiar with. So in the process of maybe learning and unlearning, I guess, in a sense, we will make mistakes, right? So we just have to kind of move past those. Then, of course, this is, again, more in context of, like, how do you maybe speak to a parent? How do you speak to people at home? How do you speak to the caregivers or people who may come to you, right? So a big point there would be understanding safety in this sense, right? So is it okay to talk to this person's parents about their gender, for example? Or is it currently unsafe to do that? Do you need to keep it limited to just the space that you have with them? And if a parent is aware of the kid's gender, if the parent is struggling, which they will be, I'm sure, just creating a space where you can offer them some resources, offer them some empathy, because again, we've all been there in that space where it feels strange to acknowledge, right? And also offering a space to ask maybe these difficult questions, ki hum ye kyun kar rahe hain? Why should we care about this, and what are pronouns, and why the hell is my child suddenly talking about this? Those kind of questions, you don't want the parent asking the kid those questions, right? You want them to maybe ask you those questions instead. So creating that space, I guess, when you're working with people in different capacities. I'm talking specifically about parents right now because fairly often, if you end up working with trans people or trans kids specifically, that is a very important area of sort of dissent, I guess. It's an area where you need to create safety very often, where safety is often not there. Yeah. And of course, like a little what we spoke about already, what are the things that maybe we can do in our day-to-day lives with colleagues that we have, with other students, with the physical environment that we're in, right? So, for example, what you said about, one of you shared about, say, safe bathrooms that are actually congruent with people's gender identities, or something like the form that we were just looking at about how to address people, right? Or something like if you ultimately, when you kind of are in a space where you're working in a clinic or in a hospital, having a space for pronouns on your intake forms, right? So a lot of different kinds of measures that can come in here. So yeah, I think that's more or less a little bit of, you know, why should we sort of care about this. But before we maybe pause, before we move to the next thing, are there any questions that you have about anything that we've spoken about today, or just, again, maybe coming back to the same idea of why should we talk about this, or why should we kind of care about this, or what next also? Yeah.
Ma'am, at what age can we start talking about pronouns to kids?
That's a great question. You can start talking to kids start learning about pronouns from around 5 or 6 years of age at school also, probably even younger, but that's when they kind of officially start learning in, say, English class. So you can start talking to them about it right from when they're 3, 4 years old, when they're picking up language, when they start understanding it better, of course, is probably when they're a little older. But yeah, there are different ways to maybe talk to kids about it, about just the idea, okay, maybe sometimes someone looks like this, but they're not a boy, for example. Yeah, that's a very basic way to kind of communicate that to a kid. Yeah, so based on the age of the kid.
Actually, at that very young age,
yeah.
Like if I give my example, I have an elder brother. So at that age, I used to follow my brother. So I used to talk like him, I used to dress like him. So I'm not sure, but I am a she, her. So I don't know if that age the kids can understand what their pronouns are, or whether they are what they are or not. So can we start at that age? I mean.
So that's a really good point, because I think that's also where we accept a lot of, say, not gender like binary behavior, right? So if you, as a 4 or 5-year-old child, you were just like, okay, this girl is behaving like a boy, that's fine, right? But as you grow older, perhaps that's not so fine, right? So I think bringing it in at that age is not so much about telling kids ki, oh, if you call yourself a he, then you are definitely a boy or something, but rather just the idea ki, okay, this is fine, like what you're experiencing is fine, because kids are already coming from that lens, ki haan, ye to theek hai. You know, this is okay, I'm just experimenting, I'm having fun. So as long as they have that in their minds, they may not grow up to be trans, but they may have a greater acceptance perhaps for people who are trans, or they may not go through that cycle that we perhaps go through, that you may have also gone through as a kid, which is like, oh, ye karna hi nahi chahiye, ladkiyan to ye karti hi nahi hai, kind of thing, right? So it might help with that process.
Also, can people go back to their pronouns? I mean, right now they're using maybe they, them, and after a certain period of time, they feel like they're again she, her. Can they?
Of course.
Okay.
Because we were talking about identity and expression, right? So if your ideas of your identity change over time, you may change your pronouns over time.
It might be confusing to other people maybe, because once we are addressing them as some they, them, and then we are going to change, next time we meet them and they're now she, her, so that we are referring them to as they, them only. It might be offensive. Or
so in that case, then the person who has changed their pronouns will probably let you know that these are not my pronouns anymore, right?
Thank you, ma'am.
Their gender identity or this pronouns so frequently in their lifetime.
So frequently as in?
Like as you people discuss, like right now they are saying that they are they or them. After some of time period, over a period, they will say I am he or his, or she or her. It is okay with them to changing so frequently, like after so many years, 5-10 years, they said now I'm going to back my previous gender identity, so it is okay.
So I'm not sure what you mean by okay here.
It means like it's a normal thing, or it's a good thing.
Again, I don't know about okay or good, but it may happen for multiple reasons. One is that when people are learning about this, they're experimenting with this, they may just try things on to see if they fit, right? So if I've decided today that I'm okay with they, them pronouns, but I'm not, let's say I don't want to identify as non-binary, I have some other gender in mind, and I stay with that for a while, maybe after a point I realize that, okay, this gender is fine, but these pronouns are not fine. Like maybe I want to use different kinds of pronouns, right? So maybe the way that they see their gender is changing with time, which is why they're changing their pronouns. Or what also happens sometimes is there's a lot of pressure that they face from people not using their correct pronouns, from constantly coming to a space like this or a classroom or whatever, having to keep identifying, having to keep justifying. So very often people will go back to their old pronouns not because, you know, they feel like it, but because they're like, acha, ye zyada aasan tha. You know, and it may not actually be congruent with their gender identity, but they're like, you know, if this is easier, if I don't have to force myself to keep talking to people about my gender all day, that might be easier for me. So they may go back for that reason, which is why I'm not sure if I can call it okay or good, right? Because it may be for different reasons. But people may change how they view their pronouns over time. But it's not just the pronouns, it's also the gender that we have to look at and what are the other factors that may be impacting that. Does that answer your question? No? Anyone else? Any questions, any thoughts, any confusion? I've also pulled together some resources, yeah, sorry. Yeah.
Just to provide respect and care, or do I need to do anything else?
Okay. Largely yes, largely it's about providing respect and care, but I think why we're talking about like what are the measures you can take at work, what are some of the other things you can do is, once we've reached that point where we realize that we want to provide respect and care, we'd like to do that, maybe it comes to, okay, how can we implement this respect and care in other spaces? Right, so that's where these measures like, okay, can I bring in, say, a form like this, or can I have a conversation with my boss about it, or can I have a conversation with my teacher about my friend who may be trans, like those kinds of things may come in more once you've come in with that idea that I'm trying to provide respect and care, right? So as a person who maybe wants to be an ally in some form, right, to trans and gender non-conforming people, all of you may have these conversations at some point with somebody, right? And they may not always be the same kind of conversation that we're having today, but maybe what you're communicating is that idea of respect and care. Ki I'm doing this, or I'm having this understanding, or having this conversation because I know that maybe I don't know everything about this, but I still care about this, and I want, like, say, this person to be okay, or I want some hypothetical person in my class who may need this someday to be okay, right? And I think maybe before we sort of talk about resources, we can talk about just being allies in general, because I think there's this very strict idea ki matlab you must know everything, right? You have to understand everything about gender, you have to be, or you have to come from a space where you must like save everybody and, you know, be like the #1 person for this at all times, which is not true. It's a very shifting position that you can take, right? If you're, I think I really like this idea of respect and care. Like if you're coming from the space of respect and care constantly, if you're aware that what you want to communicate to anybody, whether it's a future patient, whether it's a classmate, whether it's a parent, whether it's a friend, what you're communicating to them is respect and care, then that is also in itself is a form of allyship. You don't have to know everything about gender or about pronouns to actually do that. Yeah? I hope that answered your question. I know I rambled a little at the end. Yeah. Okay. Any other thoughts? So I thought that maybe this is something you can take a picture of, some resources that you can also use and that you can also share with others in this process, right? So one of the people that I had cited that statement about misgendering from is this trans athlete called Skylar. So their website is pinkmantaray.com. So they have a lot of resources on that. For parents, for kids, for people who just want to learn about all this, right? So that's a very nice space for general information. Also, the little form that I showed you is on teachingoutsidethebinary.com. There's the genderbread person, which is that identity expression thing that I had showed you. There's a website called Planned Parenthood. There's a website called Tarshi, which is Indian. And there's mypronouns.org, which is very specifically about pronouns. All the others have a lot of other information about gender and sexuality in general as well. Yeah, so just some general things that you can maybe learn a little more from. Yeah, that's it from me. Do you all have any other thoughts, any other questions? Yeah. Great. Okay. Thank you so much. Close this.
So, I think that was a wonderful session taken by Sanjana Mishra ma'am, and it was very knowledgeable and thought-provoking session, and in between also discussions were there. So I hope the topic was why pronoun have come to life, why are they important, and how to approach them and how to ask someone about them without offending them. So these areas were very beautifully explained by the speaker, and if you have any question or any doubt, you can ask. Any more questions? You have asked also in between questions. So still, if you have any more question to ask, you can ask. No further question, okay. So thank you so much, Sanjana Mishra ma'am, for letting us, or for giving the knowledge regarding this topic, and we are indebted. Thank you so much. So I would like to request Dr. Sanjay Mishra ji to felicitate Sanjana Mishra ma'am. Please come, ma'am. Please give a round of applause to Sanjana Mishra.
Thank you so much.